One of the sessions that we'll be holding during the ALT conference is the session on implementation science for cancer control in Africa. And during this session, we will be examining the nuts and bolts of implementation practice in Africa. The session is actually organized in collaboration with the NCI, IALTIC, then the African Behavioral Research Center, ABBA, the African Cancer Research and Control, ECHO, and the International Cancer Research Partnership. So all these three are collaborating, again, like I said, in conjunction with the NCI to put forward this session during IALTIC. Now, the session objectives really is to hear from our colleagues across Africa, talking about their lived experiences and the urgency and need for implementation science for cancer prevention and control in Africa. We hope to use that session to actually introduce implementation science and contextualize implementation science theories, models, frameworks, and study designs for application in Africa. In essence, we want to just look at implementation science broadly and then infuse some Afrocentric twist into it and make it more adaptable for use in Africa. And we know that a key challenge facing many African countries encumbered by limited resources is how to effectively adopt, integrate, and deliver evidence-based interventions in the local, clinical, and public health settings. So we hope to use this session to look at all the intricacies that surround the adoption, adaptation, and integration of evidence-based interventions on the continent. So we hope that at the end of the day, participants will leave with a clearer understanding of where we are and where we can potentially be and how we can rapidly build capacity for implementation science on the continent. We're going to have a pre-conference session where we have, like I said, people talk about their lived experiences. We have examples from across Africa. We picked 3 topical issues that we feel that is relatable to most of the participants during the session. And then they're going to talk about what they've done, their activities around promoting this cancer control efforts on the continent. And then we have the expert talk about the a bit more effective. At the end of the session, we hope to actually launch the implementation science special interest group, and it will culminate in a business meeting where we will look at how we can rapidly build capacity for implementation science on the continent. So we do know that one of the, in promoting implementation science on the continent, one of the gaps that we've already identified is funding. So we're going to have a panel of potential funders, and then they will talk to the participants about what they can fund, what they funded in the past regarding implementation science, and basically walk the audience through for those who are interested in doing implementation science in cancer control on the African continent. So they expose us to the varying opportunities that are there and then walk us through to see how we can secure funding to actually do the research that will hopefully change and improve cancer control on the continent. There's also going to be an additional session during the main conference. So it's broken into 2 parts. We have the pre-conference workshop where we, try to examine really more in detail as much as we can, really, the nuts and bolts of implementation science, where we are now and where we can potentially be in the coming years. So that will happen during the pre-conference workshop, whereas the workshop itself will look at, we'll be able to have little more time, but in that workshop, we will look at how we can move and rapidly build capacity for implementation science. And then we'd like to invite many people with interest in implementation science and even the uneducated really in implementation science to attend. It promises to be an interesting 2 days, and we hope that many people working across the cancer continuum would find it interesting and worthy of attendance.